Okay. So I'm here with Dr. Brandon Crosdale for our very first live interview of anyone in the whole company. So, all right, Dr. Crosdale, I'm going to ask you just a few questions. The first, I want to know, why did you get into cash pay physical therapy? And we might need to actually define cash pay, right? Maybe define cash pay physical therapy for us and why you chose to get into it.
Very good question, Kelly. First off, thanks for having me here today. It means a lot that I get to sit down and talk to you about this sort of stuff. Let's see. Defining cash pay. So, I define self-pay or cash pay as um, just a different way of accessing physical therapy resources. So, instead of using insurance, you are paying an individual physical therapist in this particular case cash for the service that you're providing, akin to how you would pay a lawyer for their type of services that they provide at a law firm.
I like that. And then I think I've heard you refer to it before as value based. So rather than thinking about the cash based, thinking about the value that we're providing and that value being greater than the patient's money, right? They will appreciate what we are able to deliver to help them to become healthier more than the money that they're holding on to. And that's kind of the mindset we try to get our patients to see. And so, why did you choose to get into cash pay?
So I chose to get into cash pay because um, my previous job or employment didn't provide me with enough income to provide for my family. So I wanted to be able to earn more based on what I thought I was worth, um, and be able to make more. So eventually, I could create the clinic that I wanted to create and give back to um, the community or give back to whoever and whatever I want. I think there's a lot of people that get into cash based because or think that you're getting into cash based just for the money, but really it's about the freedom that you can have when you take the resources that you have and put them into creating something that you think is better, or putting it into or creating something that you think is going to be just different than what everybody else is doing.
I love that. Yeah. And one of the things that I like to ask my patients is, have you had physical therapy before? What was your experience? Because, yeah, we want this to be a different experience for them, right? We want to be able to pour more of ourselves out because we're not going to patient A, B, and C. We are just
Uh,
focused on you. Yeah. So, what would you say is your favorite thing about being a physical therapist?
my favorite thing about being a physical therapist is that I get paid to tell jokes a day. Just kidding about that one. But I would definitely say my favorite thing is seeing the way that people react when you're able to make a big change, um,
Yeah.
whether it be session one, session two, session three, session four, even if it's session 10, session 20, being able to profoundly change the way that they move is incredible. It's the thing that really keeps me wanting to improve my skills in the world of physical therapy, to see people react that way. Obviously, there are positive reactions and sort of negative reactions to physical therapy, but to see people in the end recover from whatever it is that they were struggling from and maybe get rid of it for good, it feels good. And
Yeah.
it really does drive me to do better every day in this profession.
I'm not sure everybody's professions can say that.
Yeah,
Yeah.
for
Like when
sure.
people leave, they feel better. They're stronger. Yeah, absolutely. And so do you have like a short little antidote of maybe your favorite patient, maybe the one that you made the most impact on their lives, or maybe even the patient that made the most impact on your life?
I've got a couple, but I think there was one patient in particular that made a huge impact on both of our lives, I would say. I was a resident maybe 8 or 9 years ago at this point, and I had a patient that had just the worst debilitating headaches slash migraines.
Mm.
And through treating them, and mind you, when they first came in to see me, they didn't really want to see me,
They've
right?
been through everybody.
They sort of came to physical therapy thinking it was sort of a chore. They just had to be here for insurance purposes and that they were just here because their doctors just told them to go here. And at the time, for me, I could sense that they didn't want to be here and just a very sort of closed off posturing during the exam. And as we got through the exam and we were able to make a significant change the first visit, that's when that person started to open up about their life and just the other things that um, were maybe stopping them from being able to fully recover from the headaches and some of the stress that was going on in their life. And by the end of their treatment, headache free, as far as I know, they're probably still
Wow.
headache free at this point. So
But you said it was also the most impactful on you. So how did it impact you?
it impacted me in a positive way because it continues to prove to me that people have the ability to change as long as they believe they can change.
Mm, that mindset.
Yeah, that mindset's super, super important. And if they're not coming in with that mindset, we have the ability to shake their belief foundation and restructure and help them rethink the way that they can approach the world mentally and physically.
I like that. And so you've done some extra training on that too, right? You're a certified, is it life coach? Is that what it is?
So I've done some training with lifestyle medicine, and I am a lifestyle medicine professional. And lifestyle medicine just dives into the other aspect of lifestyle. And in um, in conjunction with um, the first line of treatment, say you have high blood pressure, um, physician will give you blood pressure medication. Lifestyle changes are also being prescribed to create the greatest benefit for said patient so that they can, in some cases, reverse or reduce their blood pressure or reduce or reverse their diabetes or even do some preventative work so that they can maintain their healthy lifestyle or maintain what we call their health span, how many years they are healthy before they pass.
Yeah. And so, did any of that training help prepare you for that mindset? Because that is such a big deal. And we as healthcare providers have the unique opportunity to probably sit down and have more one-on-one FaceTime, really asking the questions of like why and what, and kind of pulling in all those factors to their pathology. But did any of that kind of certification prepare you for that mindset shift, or do you have any, maybe even any advice to other providers when that patient comes in closed off? Especially you see this in insurance, like heavy caseload. You see this where the doctors are, you got to do this to get the MRI, you got to do this after surgery, before surgery. And so just that attitude of like, I didn't want to be here, I didn't look to be here, but I've got to be here. So what's your training or advice on that mindset for other physical therapists?
Yeah, I would definitely say in my residency, I learned a lot about social and emotional intelligence, and I would credit that to a lot of these sort of social and self-awareness and relationship management um, skills that allowed me to navigate some uncomfortable conversation or uncomfortable spaces with patients that don't want to be there because they don't want to be there because maybe they're thinking this isn't going to work for me.
Yeah.
right? Or I was just told what to do, sort of the approach rather than the coaching approach, which was, what do you think you'll get out of physical therapy?
Oh, I like that. Expert versus coach. Yeah. Yes.
Yeah,
That's really impactful. That could be a really big deal when you think, because we do have a lot of expertise, and so we want to just pour it out at them. We love the details. Most physical therapists are pretty analytical, but just throwing a bunch of information at them is sometimes that's what they're getting elsewhere. So we have the opportunity, yes, to give some more coaching. I like that. I like that a lot. Okay. So I love these stories about your professional life, but also you have a very interesting personal life in that you have identical twin boys.
yeah, they're my little miracles. I have a
Yeah,
wonderful wife and identical twin boys, and they they're my pride and joy. They are the reason that I went into cash-based or self-pay PT so that I could provide for them more and just spend more time with them.
I love that. So I only had one kid at a time. However, I did it 4 times, but only one at a time. And
Impressive.
I cannot imagine the double the bottles, double the diapers, double the everything. What was one of the biggest things? I'm sure there were lots of big hurdles to overcome with raising twins the first year of their life. But what do you think was one of the hardest things that was solely attributed that there were two of them?
That's a good question. Um, I think I guess I should talk about this first. So my wife had a C-section, and
Mhm.
she had a epidural. So for a certain period of time, she couldn't do a lot of those physical things in terms of like being able to care for the kids.
Yeah.
In fact, one of our kids was in the NICU, and I would go see him every day. And then if my wife wanted to go see him, I would bring her in a wheelchair up to the NICU so that she
Mm.
could see her son.
Yeah.
And I would definitely say when he came home, because he didn't come home at first when we got out of the hospital, when he came home, that was the most difficult time because um, while she was going through motherly things, learning how to breastfeed and just producing her milk, right?
Yeah.
I was up feeding said children every like 2 hours for I don't even know how long, but
A while.
um, a while. It was I got up and fed one, and then maybe 20 minutes later I had to go feed another, and then I went back to sleep for maybe an hour, and then
Yeah.
I had to do that throughout the night.
Oh,
So
yeah.
I definitely say that was the most difficult thing that I personally had to do, but I would do it again, 100%.
Of course. Of course. Yeah. And now how old are they?
17 going on 18 months
Yes. And running around the house.
and running around the house.
Yeah.
Yes, and screaming and all the wonderful things that they do at this age.
Oh, that's so fun. Okay. And the last thing I think is one of the things, many things I think is so interesting about you is that you also are vegan.
Yeah.
And one of the reasons, I'll let you tell it, but I hope you can think of the one that you told me that I think is so fascinating. One of like the biggest reason why you decided to go vegan. What was that?
So in 2020, after I got my house, I um, wasn't in the greatest physical shape, and I wasn't in the greatest, I guess, physical state. I didn't have great blood pressure either, and blood pressure
Oh,
issues
interesting.
run in my family. And my grandmother had recently passed away from cancer, so I took it upon myself to start regularly exercising again since my I had more of an open space. Come many months later, I was physically better, but none of my biomarkers in terms of blood pressure had really changed very much. And I knew
Oh,
I probably had to change my
yeah.
diet and I was just like, oh, I'll just wait. I'll just wait. Then I critically injured my back, like really, really bad. I had to go to physical therapy. But before that, I could barely sit for 2 minutes. I was walking around all crooked and whatnot. And my grandfather had passed away that same month. And I
Mm,
just remember the funeral was virtual because it was 2020 COVID times.
yeah.
And at one point, I was going to speak to the entire everybody at the funeral. And I couldn't sit long enough to do that, and it sort of just broke my heart. And I said I
Yeah.
need to start taking better care of myself, not only because of what had happened to my grandparents, but because I just need to take health and wellness a little bit more seriously. So, 2020, after Thanksgiving, I just decided to go plant-based or vegan,
Hmm.
and yeah, it's hugely improved my physical fitness. So um, just my mental acuity and awareness as well. Yeah,
And one of the things you said was I wanted to prove to people they could still have muscle bulk, like stay
yeah,
strong, but also be vegan, which I
yeah,
thought was so interesting because I was like, you're right. You think of like, like skinny, kind of fragile women
yeah,
who are vegan, and it's like you're out there showing everybody that that's not the way.
yeah. Initially, it was just I just wanted to feel a little bit better, and through a lot of the vegan coaching that I've done, a lot of people are like, "You're a bigger guy. How do you get this way?" And
Yeah,
just being able to guide people through that has been really helpful for them in feeling more confident in their body. Not that it's all about looking more muscular, but who doesn't want to look more muscular?
right. Yeah. So physical therapy, doctor of physical therapy, uh, a resident, you did a residency, vegan coach, right? Also a lifestyle, what was the life and health certification that you have?
A lifestyle medicine professional.
Lifestyle medicine. And any more? Personal trainer. Did I say that?
There's 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 lots of things, but the most important thing is human that cares about you and wants to see you get better. And if I can't get you better, we'll send you someplace else.
I love it. Yeah. Thank you so much, Brandon. This is gonna be
Of
great.
course.
Yes. Okay. I'll end that there, the recording, but that was